causes crystals to form? Why do some crystals develop into kidney stones and others do not? One critical factor is supersaturation of the urine with stone-forming salts. Supersaturation is the driving force for crystallization. In undersaturated urine, crystals cannot form. The other important factor is a deficiency in substances called inhibitors. Inhibitors retard the nucleation, growth, and aggregation process by binding ions needed for crystal formation and growth. One of the most important inhibitors is citrate. Urine saturation and inhibitor levels explain why, in normal patients, large crystals are not formed. Their urine is not as saturated, and they have sufficient quantities of inhibitors present. But the urine of patients with kidney stones is more saturated. It may also lack inhibitors that increase the propensity for crystallization of stone-forming salts. There are two reasons for this. First, stone formers are known to suffer from a variety of metabolic disturbances that increase the amount of stone-forming substances excreted in the urine and also decrease the excretion of inhibitors. Second, a number of common nutritional and environmental factors can cause abnormalities in the urine. These factors may also exaggerate underlying abnormalities due to metabolic disturbances. Environmental stresses, for example, play a significant role in stone disease, especially factors that trigger excess water conservation in the kidney, such as inadequate fluid intake. Dehydration is a major cause of kidney stones, which is why people living in areas with high temperatures and humidity have a higher incidence of stone formation. A diet high in sodium is a double risk, because it increases calcium excretion and reduces urinary levels of stone-inhibiting citrate. Too much animal protein creates similar problems, encouraging stone growth by increasing urinary uric acid and reducing urinary citrate. Certain medications are also known to encourage stone formation or growth in susceptible patients, including common supplements such as vitamin C. There is no cure for kidney stones, but once an acute episode has been resolved, the key to therapy is simple: preventing recurrence. And fortunately, the most common stones, calcium oxalate and calcium phosphate, can be effectively managed with a combination of diet and lifestyle changes and medication. Compliance with proven management guidelines, such as increasing fluid intake and avoiding stone-promoting foods, can significantly reduce stone recurrence. Medical therapy